Black lung disease was a disease that was thought to be eradicated in Australia, and silicosis is similar. Unfortunately, we've seen a significant re-emergence of black lung disease in Queensland, and we've also unfortunately seen a massive re-emergence of silicosis over the last 2 years, in particular in young tradies in the manufacturing and the construction sector. So I'm going to go through a few things today, but I first of all wanted to begin by telling you about a patient that I recently assessed. So a 34-year-old stonemason. So he's married, has 3 young children, all less than 10 years of age. His work has primarily involved production of kitchen and bathroom bench tops. So as part of his work, he cuts these slabs of stone to size, and then he usually uses hand tools to cut out the inserts. So cut out the inserts for the sinks and for the tapware. He's been working in this industry for about a decade, and really since the mid-2000s, 95% of his work is with artificial stone, in particular Caesar stone's the most common stone that he uses. During his apprenticeship, and he did undertake an apprenticeship as a stonemason, he was never educated about risk related to silica dust exposure. And during his work, he was never screened for a possible occupational lung disease. So in 2014, he first saw his GP. He had a persistent dry cough, it just wasn't going away. His GP tried him on a couple of inhalers, thought maybe it was asthma, but his symptoms didn't improve. In fact, he got worse. So over the next year, the cough worsened and he became more short of breath, and particularly noticed this when he was playing with his kids. So his GP then referred him to a respiratory specialist for further testing. He had a CT scan of his lungs and he had some other testing done, and he was diagnosed with silicosis. Because of this disease, he was told he shouldn't return to his workplace anymore because further silica exposure was likely to worsen his condition. So he took that advice and didn't return to work, but his condition deteriorated. So over the following 2.5 years, he's now developed what's known as progressive massive fibrosis over a very rapid period of time. He's now short of breath when he walks 100 metres and he can't play with his kids anymore. His lung function has deteriorated to 50% what it should be. And there's no treatment for this preventable occupational lung disease. His only hope now is lung transplantation. So there are many diseases that are associated with silica exposure, and what we're most concerned about at the moment are these forms of silicosis known as acute silicosis and accelerated silicosis. And these are diseases that are actually quite different to chronic silicosis. Acute and accelerated silicosis are associated with high intensity exposure to silica dust. There have been many outbreaks of silicosis and acute silicosis over time. So this is from 1900 in Utah. This is the Delamar quartz mill, and there were 100 deaths here over a 5-year period. Then in the 1930s in the US, there was 480 workers that died over a 5-year period. This is the Hawker's Nest tunnel, and this is acknowledged as one of the worst industrial disasters in US history. More recently, there have been clusters of acute silicosis associated with other exposures. One of the most well described relates to sandblasting of jeans. This was a practice that was quite common in Turkey to provide the aged look on denim jeans. There's also been outbreaks in dental laboratory technicians in the United States, in the sandblasting of oil-filled pipelines, and more recently in hydraulic fracking for gas and oil extraction. But what we're most concerned about at the moment is the use of artificial stone. And so this comes by various other names, so engineered stone, reconstituted stone, quartz conglomerate. There's a lot of different names that's used for this product. And there are a variety of companies that do produce this stone. Caesar stone would be the most commonly known form of it. It's been available only in Australia since 2001, so it's a relatively new building material in our country. But since that time, it's become an extremely popular building material. So what is artificial stone? So essentially artificial stone's made from finely crushed silica-containing rocks. And these rocks are crushed to almost a powder-like consistency. and then they're bound together with a resin, and then they're formed into slabs by this process of pressure and heat curing. And so the major issue with this product is that it contains an extremely high level of silica. So the natural stones which have been commonly used to form bench tops include marble and granite, and marble only actually has 2% silica in it, and granite typically about 30% silica, whereas artificial stone has greater than 85% crystalline silica, which is actually comparable to the amount of silica that's in sandstone. So workers then will cut the slabs of stone, they'll cut them down to size, and then they'll cut out the inserts, as I mentioned before, for tapware, for sinks, etc. And they'll often do this with hand tools. Unfortunately, despite the known high level of silica in the product, there's been very little research that's been done into occupational exposure to silica in this industry. So the SafeWork New South Wales Hygiene and Toxicology team, pleasingly, have actually been quite proactive about this issue over the last year. And they undertook a study, and the results of this they presented at the ICO conference in Dublin earlier this year. And what they did was that they went out to 6 different workplaces, and they monitored exposure to silica dust amongst 35 workers. So they had personal monitoring over that 8-hour work period. And the results were really quite alarming. So they found with the polishing of stone that the average level of exposure to silica dust was 0.2 milligrams over an 8-hour period, which is currently double the exposure standard. That's the average level of exposure. And some workers were exposed to levels of 2, which is 20 times higher than the current exposure standard. Wet cutting, which has been by some people thought to be a safe work practice with cutting the stone, was also associated with a level that is in exceedance of the current exposure standard, and also with some levels of extremely high proportions amongst workers. And of note, there were actually some people that were not actually on the plant floor. They were actually likely in the office environment next to the workshop, where they were also exposed to levels above the current standard. And that study didn't actually look at what's thought to be the most dangerous, the most hazardous form of dealing with the stone, which is dry cutting. And from the workers that I've seen, dry cutting has been a very, very common practice with this stone. This one study investigated, and they looked at the amount of exposure to silica dust over a 30-minute period. And the current recommended standard is to not exceed 0.3 milligrams per cubic metre over a 30-minute period. And they recorded levels of 44, so 150 times higher than the current recommended standard. The first report of silicosis from this product was in Italy in 2011. So relatively recent identification of this condition, and since that time there have been many more reports, many more clusters that have been described in the medical literature. Many from Europe, and now many from America as well. Caesarstone is a company that's based in Israel, and they've been producing this stone since the late 1980s and have been using it for obviously much longer than we have in Australia. And currently they report 40 new cases of silicosis per year due to artificial stone work. And 4% of all their lung transplants are performed because of this disease. So what have we seen in Australia recently? So early in mid-2017, through discussion with colleagues in the Thoracic Society of Australia and New Zealand, we tried to collate our information about the workers we'd seen in our day-to-day practices as respiratory physicians. And these are doctors from New South Wales and Queensland, as well as here in Victoria. So we rapidly identified 7 workers, and what was most troubling was the range of age of these workers, with some being in their mid-20s. They'd worked with stone for a relatively short period of time, for between 4 years and 10 years, prior to the onset of their symptoms. There was no health surveillance performed at any of their workplace. None had screening chest x-rays performed, even though that's actually part of the regulations related to silica exposure. There were relatively small workplaces, between 2 and 20 workers at each workplace, and many came from overseas initially. What we found when we looked at data related to their lung function was that they had a rapid decline in their lung function. So after diagnosis, they had on average, a 30 times greater than expected rate of decline of their lung function in comparison to a healthy adult. And we found that looking at their CT imaging as well, they also had a rapid progression from mild simple silicosis through to this terrible form of disease known as progressive massive fibrosis. And even after leaving their workplaces, they had ongoing deterioration in their lung function and their condition. But these workers that we described mid last year are really just the tip of the iceberg. These are workers that became apparent to us as respiratory physicians, and there's quite a few steps to actually get to see a respiratory physician. They're all workers that presented with symptoms. They presented with cough, shortness of breath. They weren't picked up at an early stage. So health surveillance has not been performed in this industry, and it really must be performed to identify workers at an early stage before they actually develop severe lung disease. Just this week, speaking to a colleague in Queensland, an occupational physician in Queensland, because of some increase in awareness of this issue, he has been engaged by 2 employers that run businesses, and these employers are extremely concerned about this issue. And he engaged the occupational physician to screen their workers. And out of 35 workers that he screened, he identified 12 with silicosis. So a third of the workforce. There's very limited information at the moment about the effectiveness of dust control measures using artificial stone. The studies really haven't been done to show what practice is actually safe. We really need objective demonstration of workplace silica dust levels. Going into a workplace and doing a visual inspection of a workplace is not sufficient to determine whether the level of dust in that environment is actually safe. And the hazardous chemicals regulations related to silica must be enforced. These regulations are in place, and certainly in my opinion and my experience here in Victoria, these regulations in this industry are not enforced whatsoever. So there has been an increase in media attention about this issue over the last few months, and this is primarily because of a very brave stonemason from the Gold Coast, Anthony White, who has been brave enough to tell his story about his silicosis and the severity of his disease and what he's experienced over the last few months. And it's only really through Anthony stepping up and talking about what he's actually experienced that there has been an increase in awareness of this problem in Queensland and in New South Wales, but we really need to do a lot more here in Victoria as well.